The Kenya Medical Practitioners, Pharmacists and Dentists Union, KMPDU, has announced a constitutional amendment process to establish a health service commission they say will manage critical health personnel for the stability in the health sector and successfully roll out the universal health care coverage in the country. KMPDU Secretary General, that is Davji Atellah, says the union targets to collect and submit 7.2 million signatures to the Independent Electoral and Boundaries Commission, IEBC, by June 2023 in support of the initiative for constitutional changes.
Flanked by a section of civil society groups, the Health Workers Union called for an honest audit of the status of the Kenyan health sector 10 years into devolution.
We have, for the last 10 years, more than 5,000 doctors, more than 10,000 clinical officers, more than 20,000 nurses who have graduated from different institutions, but then the government has not have any plans to employ them. There's no annual employment of healthcare workers in this country, to the point that if the Kenyans go to the hospitals, they are suffering, they cannot get the services that they need.
Among the functions of the proposed Health Service Commission will be to register trained health workers, recruit and employ registered health workers, and assign health workers employed by the Commission for service in any public hospital or health facility in the country.
For Kenyans to access healthcare, we need Health Service Commission. This is a rallying call for Kenyans to own the process, for the civil society to own the process, for the association to own the process, so that when you are in any facility that you visit, your constitutional right as per the Article 43 is ensured, that you get the health that you deserve, you get the health care that you need. So that is the discussion that we've had, and we have decided to work together as equal partners in this consortium.
KMPDU Secretary General Dr. Davji Atellah said an honest audit of the status of the Kenyan health sector 10 years into devolution shows the country continues to face immense challenges in the leadership and governance of a health sector.
We need to have a framework that will ensure that healthcare workers are paid their salaries on time, that they don't need to wait for 3, 5, 4 months before they get their salaries, that the money should not come from exchequer to the counties, to development, to loans, and then to salaries. We need Health Service Commission. We have to come to a point that we realize that we should not subject healthcare workers to the politics of the counties, to the point that the functional of healthcare is put secondary to all other functions. And therefore we need a centralized management of health workers, that is Health Service Commission.
Despite 24 failed attempts to amend the 2010 Constitution, health workers believe the Commission will go a long way in addressing the many challenges faced by medics in the country. Ben Chumba, Prime Edition.